Hello everyone, I would like to talk about home modifications and home safety. My name is Roderick Chua. I have a Bachelor of Science in Physical Therapy and currently a transitional DPT student at University of Michigan Flint. I have over 10 years of work experience in a variety of settings, and I'm currently in home health, practicing for approximately 10 years, and I live in Chicago, Illinois. The target audience for this presentation are the physical therapists and discharge planners so that they could gain knowledge to ensure that patients going home or at home have a safe home environment. First, let's take a look at this video here. What do you think happened here, and what could have prevented this? By looking at the environment of this home, we could possibly cite some factors that contributed to this patient falling, such as lack of handrails, poor lighting, perhaps poor flooring, uneven steps, or maybe loose carpeting. These are what we call environmental barriers, and they are defined as physical impediments that prevent individuals from functioning optimally in their surroundings, and they include safety hazards, access problems, and home or workplace design difficulties. Other examples include narrow doorways, low or high counters and cabinets, lack of lighting, slippery tub or shower floor, or lack of grab bars. The purpose of home safety modifications and safety include: number one, determine the degree of patient safety and level of function in the physical environment. Number two, identify design barriers that may affect usability or compromise performance of customary tasks or activities. Number three, make realistic recommendations regarding environmental accessibility and accommodations to the patient, family or caregivers, employer, government agencies, or other potential funding sources and third-party payers. Number four, determine the need for adaptive equipment or assistive technology to support and promote function. Number five, assist in preparing the patient and family or caregivers for the patient's return to a former environment and to help determine whether further services may be required, for example, outpatient treatment, home care services, and so forth. So why is it relevant? So for older adults, a fall can be the beginning of the end. Each year, thousands of older Americans fall at home. Many of them are seriously injured and some are disabled. In 2002, more than 12,800 people over the age of 65 died, and 1.6 million were treated in emergency departments because of falls. Falls are often due to hazards that are easy to overlook but easy to fix. Home modifications reduce falls among higher-risk community-dwelling elderly by 39%. Despite the recommendations from American Geriatric Society, home modification implementation is not a standard practice in the U.S. Let's stop here and reflect on a case scenario. So a patient that you are seeing at the hospital is set to go home in a few days. He has status post left ankle arthrodesis, uses auxiliary crutches, and will be sent home with a wheelchair when the need arises. He is using bifocal lenses. You're assigned to do a home environment interview before discharge and subsequently do an on-site home assessment. What are the environmental considerations you should take? In the following slides, the general concept of home modifications and safety will be applied to this particular patient, and as well to the general population. These are the considerations to take. Access to home. Is there a ramp? The minimum ramp grade for a wheelchair ramp is 1:12. That is, for every an inch rise of the ramp, there should be an equivalent increase in length of about 12 inches. Are there steps? Consider the height, number, and condition of the stairs. The ideal step is 7 inches high with a depth of 11 inches. The lips or nose of the steps need to be removed or reduced using bevels because these lips can catch toes and cause a person to fall. A non-slip surface should be considered, and using abrasive strips can increase the traction of the steps. This is the example of the use of bevels to remove the nose of the steps, and the use of abrasive strips to improve traction and depth perception. Are there handrails? Handrails need to be a minimum of 34 inches high or a maximum of 38 inches to allow accommodations for tall or short persons. Should extend 12 inches beyond the top or the foot of the stairs with a diameter of 1.25 inches minimum or a maximum of 2 inches, and a wall clearance of 1.5 inches. At the top or the bottom of the floor or the ramp should have a platform at an area of 5 by 5 feet to allow ample space for wheelchair users. Interior accessibility, we should consider the furniture arrangement and features. Furniture should be arranged to allow sufficient room for wheelchair or assistive device users by pushing them closer to the wall. Should also allow clear pathways, and the chairs need to have double armrest to assist with sit-to-stand transfers, and the use of rocking chairs is not recommended. This is the example of the handrails extension going 12 inches beyond at the top of the stairs. Lighting. Vision may be enhanced by use of high wattage bulbs, fluorescent lights, full spectrum bulbs, daylight bulbs, or high intensity halogen lamps. The use of electrical timers to turn on light and motion detecting night lights can enhance vision for the visually impaired. Flooring needs to be level and non-slip, and wooden floor should have a matte finish to reduce glare. Throw rugs needs to be glued or taped or removed, and avoid bold patterns or colorful carpets. The doors need to have the thresholds removed with a clearance of 32 inches for wheelchair or assistive device users. The stairs, indoor stairs should be well lighted and with handrails, should be free of clutter. Consider adhesive or light reflective tactile warning strips, and light switch needs to be at both ends of the stairs. The bathroom. Grab bars for toilet or tub transfers should have a diameter of 1.25 inches to 2 inches with a knurled surface to improve tactile cues and texture. Grab bars for toilet transfer should be mounted 33 to 36 inches horizontally from the floor, and then 42 to 54 inches on the side wall and 24 to 36 inches on the back wall. The use of 2 grab bars mounted horizontally on the back wall for tub transfers. One needs to be 33 to 36 inches from the tub floor, and the other one is 9 inches from the rim of the tub. Should use non-skid adhesive tapes on the floor of the tub or the shower, and the sink should provide adequate knee clearance. These are the examples for the grab bars. The kitchen. Ideal countertop height needs to be no more than 31 inches with a depth of 24 inches. Colored tape along the border should be considered for the visually impaired, and the use of smoke and carbon monoxide detectors is recommended. Keeping things within easy reach by moving items from high to low cabinets or shelves is recommended, and at the waist level is ideal. Let's consider a few case scenarios again. So a patient was referred to you for home health PT due to frequent falls. Upon finishing your screen, you as a therapist are baffled as she seems to have good balance and adequate strength. You then find out that she has impaired vision. Later on, when you check her apartment, she has clutter and electrical cords all over the place with busted lights in a few rooms. What are the steps will you take and suggest to improve home safety? And another case scenario. A patient will be going home tomorrow after undergoing total knee replacement. She has a hard time doing sit-to-stand transfers, especially in low chairs, and getting up from the toilet. What home modifications will you recommend for this patient? The following is a tool that you can use to assess the general environment of the patient. It's an easy yes or no question that will help you identify which area needs modification in the patient's home, such as floors. Question: when you walk through your rooms, do you have to walk around furniture? Do you have throw rugs on the floor? Are there papers, books, towels, shoes, magazines, or other objects on the floor? Do you have to walk over or around wires or cords? Do you have carpeting or wood on your floors? For the stairs, are there papers or other objects on the stairs? Are some steps broken or are uneven? Are you missing a light or over the stairway? Do you have only one light switch for your stairs, either at the top or the bottom? Do you have carpeting on your steps? Is it loose or torn? Are the handrails loose or broken? Is it only on one side of the stairs? With regards to the kitchen, are the things you see often on high shelves? Does your counter or tables give you leg room? For the bathroom, is the tub or shower floor slippery? Do you need some support when you get in and out of the tub or up from the toilet? For the bedroom, is the light near the bed hard to reach? Is the path from your bed to the bathroom dark? The entryway, do you have a ramp to go in and out of your house? Are you able to go in and out of the doorway in your house without bumping the corners? Do you have thresholds or seals on your doorways? And this is the link to download that tool. So just copy and paste. I'd like to end this presentation with a quote from Le Corbusier: "The home should be the treasure chest of living." These are the references. And thank you for listening to this presentation. Have a great day.